I am so excited to introduce our next speaker, Dr. Jody Jedlicka. Dr. Jody is a doctor of audiology with over 30 years of experience helping children and families understand and overcome learning and communication challenges. She has provided audiological services to public schools, served as clinical educator and supervisor to graduate students, training them in auditory processing disorder evaluation and treatment, and has owned a private audiology practice focused on auditory processing disorders. Dr. Jody has extensive experience working directly with schools and families to implement effective accommodations and interventions. She is currently the Director of Support for Learning RX, a national network of cognitive training centers where she provides strategic support to professionals working with struggling learners. She is also the co-host of 2 podcasts, including The Brainy Moms and The Sisterhood of Success. In all her roles, Dr. Jedlicka is passionate about empowering families with tools to recognize, understand, and address cognitive and auditory processing issues to help every child reach their potential. She is here today to share some of her expertise on auditory processing disorders with us. Please join me in giving a warm welcome to Dr. Jody Jedlicka.
Thank you, Dr. Amy. All right, so this morning we're going to talk about auditory processing disorders, and I just want to start out by telling you a funny story. In my 30 years of audiology, one thing that people say routinely to me that is always surprising every time I hear it is that they hear better with their glasses on. I know, that's so strange, isn't it? And it cracks me up every time I hear it. But this morning, I want to talk to you about auditory processing disorders, why we hear better with our glasses on, and why all of this is important. One of the first tasks that I had, my first job out of college was that I worked as an educational audiologist for Milwaukee Public Schools. And one of the first tasks that I was given when I started there, this was back in 1990, was to start a hearing screening program for that school district. Now, hearing screenings are actually really easy to do. However, if you consider that in 1990, Milwaukee Public Schools had 110 elementary schools and served over 100,000 students, this was a big job. And when kids get to be school age, it's really uncommon that you would diagnose a severe or a significant hearing loss at that point. So if they had a severe or profound hearing loss, somebody would have noticed by the time they got to school. And so the way we had our hearing screening set up is that we tested all the kindergarten through 3rd graders. Those got tested at the schools by volunteers or the school speech pathologist or someone on the staff there. And then the kids who passed that test, they were removed from this process. The kids who failed that screening, we waited about 6 weeks or so for any colds or ear infections or anything like that to clear up, and then we screened them again. And again, anyone who passed that second screening, they were removed from the process, but the rest of those kids who failed that second screening came to us. We had a diagnostic audiology suite in one of the schools, and they came to us for diagnostic testing. And because most kids with a severe hearing loss are already eliminated, somebody's noticed that they have a problem by then, the hearing losses that we diagnosed or were dealing with were more subtle than that. And so we were seeing kids with unilateral hearing losses. That means that they have a hearing loss in one ear, but their other ear is hearing within normal limits. And actually back in the early 90s, we were taught in school that one ear is good enough. What we found out since that time is that those kids with unilateral hearing losses are actually 10 times more likely to experience academic failure, failing a grade, requiring extra support in school than their normal hearing peers. We also saw kids with minimal hearing losses. And so a minimal hearing loss means that they can hear speech at conversational levels, which means that they're developing language, they're responding most of the time. They may be a little inconsistent in their responding to sound, but for the most part, they're developing like we want them to be. And as long as we're putting them into good listening environments, easy listening environments, they don't have too much trouble. But if we put them into challenging listening environments where there's some background noise or car noise or road noise, they have more difficulty in those situations. But sometimes it's easy to chalk up those kind of inconsistent behaviors to either behavior problems or attention challenges or things like that. And it's important to know which one you're dealing with. So we had those. And then we had this whole group of kids who came to us who presented like they had a hearing loss. They had behaviors consistent with a hearing loss. But when we did their diagnostic testing, they scored just fine. And so those were our kids that we suspected of having auditory processing disorders. And back then, while we knew that we could diagnose that problem, we didn't really know what to do with them. We knew what to do with peripheral hearing losses or hearing losses that happened in the ears. We didn't always know how to handle the auditory processing kids. So I remember discussing with my coworker and saying to her, so it was just her and I in here, and we both started on the same day. But I remember saying to her, or noticing how many of those kids that we were testing with minimal hearing losses, unilateral hearing losses, or these kids who we knew had something else going on, but we weren't sure exactly what it was, but we suspected it was that weird thing that we heard once or twice in college, the auditory processing disorders. And I remember us thinking that if we could solve this problem for people, we could solve a whole lot of educational issues if we just knew how to handle it better. And so it just became one of those problems where you dig into, and I just couldn't let it go. And so started learning as much as I could about this. I remember going to a conference where two of our current leading national experts on auditory processing came together and spoke for the very first time, Dr. Terry Bellis and Dr. Bellis-Ferre. And that was the first time that they had connected and coordinated with each other. But what they found when they joined forces was that if they could, that they noticed when they were testing kids that they seemed to follow a specific pattern of, they could identify specific patterns of weakness. And once they could do that, they knew exactly how to treat those disorders. So we'll talk more about that, but let's back up one step. If you ask any 4-year-old how you hear, they'll say they hear with their ears, right? Yes? Any of you have a 4-year-old? Anyway, it's so much more complicated than that. Your ears perceive sound, but they're just taking in that sound and sending it up to your brain. Your brain is really where hearing happens. And so auditory processing is actually how your brain hears. Auditory processing is how your brain hears. So it actually even gets more complicated than that, because different pieces of the auditory signal get detected and interpreted in different parts of your brain. And if we can identify what part of the brain those weaknesses are happening in, then we know better what to do about them. So Bellis-Ferre actually identified 5 very specific patterns of test results, and realized that those patterns of test results had very specific behavioral challenges that went with them. They called these different categories subtypes, and each of these subtypes, because of the predictable behavioral profiles that went with them, each of them could be treated in a different way. So we're going to talk a little bit about each of these different behavioral profiles, what those look like, what challenges those kids come with, and then what can be done about that. So just a note about auditory processing and how you diagnose that disorder. An auditory processing disorder is always diagnosed by an audiologist. If they come from a psychologist's office and they're saying that they have an auditory processing disorder, they may suspect that. There may be some characteristics of that, but an audiologist is the professional who diagnoses that. Audiologists, it's not just your average run-of-the-mill corner audiologist who does that also. It's got to be somebody who's put in extra time and training in learning about auditory processing disorders and how to diagnose them and treat them. Most of them don't even have those tests in their office. And last but not least, audiologists are just, the tests that we use are designed to really stress the auditory system, really dig deep into the auditory system. And when we look for those patterns of challenge, those are easily identifiable by looking at those tests. When we talk about treatment planning using the Bellis-Ferre model, we want to be able to match the intervention to the subtype that we've identified. There are a variety of different professionals that can be involved in treating those disorders, and we also want to leverage what we call brain plasticity. And what that means is that auditory processing is a skill. It's a skill that if you practice it, you get better at it. And so if we can identify the place in the brain where that weakness is happening, we can exercise that, make it better. When we talk about treatment planning, we want to think about environmental modifications. So that means making the environment where the child is listening in easier for them to hear in. And we're going to treat that differently depending on what the subtype that we're working with is. We want to look at compensatory strategies. And I look at compensatory strategies as teaching the child or the adults who support that child, teaching them different strategies to help the child work around their disorder, okay? And last but not least, we also want to do therapeutic remediation, and that means that's that practice that I talked about. So that's giving them those opportunities to practice those weak skills so that they get better at them. The first type of subtype that I want to talk about is an auditory decoding deficit. And I know you're not supposed to have favorites, right? But this one's my favorite. And it's my favorite because it's so amenable to remediation. This one can get so much better so quickly. And so it's just really exciting to see that happen for kids. But kids with an auditory decoding deficit have difficulty hearing sounds, hearing them in the right order, hearing them accurately, being able to play with and manipulate the sounds. And if the sound coming in isn't really clear, or the environment that they're listening to is a challenging listening environment, there's background noise, they're not looking at the face of the person who's talking. These are the kids who hear better with their glasses on, right? And so if they don't have a good signal, everything just sounds a little bit muffled to them. So if I'm standing in front of you and you have the benefit of seeing my face, it's much easier for you to be able to hear and interpret because you've got lots of clues playing into that. So these kids will mishear. Their mom will say they can't hear me if they're sitting in the back seat of the car, but they can hear me if they're sitting in the front seat and they're looking at me. They rely on those external cues to kind of fill in the missing pieces of the message so that they can interpret it correctly. They will often, very often, have difficulty with learning reading, spelling, and phonics. And they will have, like I said, more difficulty listening in challenging listening situations. So what do we do for kids who have an auditory decoding deficit? For this group of kids, your environmental modification should focus on making the environment easy. And so you want to focus on quiet environment, making it, toning down the background noise, having them sit in a classroom with what we call preferential seating, meaning they're close to the teacher, they can hear her, and they can see her face while she's talking. That's sometimes really difficult. That sounds like an easy thing to do, but teachers walk around while they're teaching. They move around the classroom, and we teach them to do that. So you need a teacher who's willing to stay put and be cognizant of that. Environmental, compensatory strategies rather, would be there's a lot of equipment available that can make listening easier for a student. So we might use something like a classroom amplification system or an FM system, and that is where the speaker is wearing a microphone and they're transmitting directly to the student's ears, or where we're putting a speaker in the classroom and the teacher is wearing a microphone and we're making the signal just a little bit louder for everybody in the room. Remediation activities, those should consist of auditory training activities. And auditory training is practicing using those sounds, practicing hearing them accurately, hearing them in the right order, being able to play with and manipulate those sounds. And again, being very targeted about what sounds you're working on and noticing or recognizing where their struggles are so that you can hone in or target those challenging sounds. So the other piece of this is, or another subtype of this is prosody. Prosody is the ability to understand the meaning or the stress or the intonation behind what someone is saying. How many people in this room have ever misunderstood an email or a text message because you couldn't hear the kind of meaning behind what it was saying, right? You just have the words, no meaning, right? So a prosodic deficit focuses on or is a weakness in their ability to hear and understand that tone of voice that conveys so much meaning. These kids will misunderstand intent or emotion. And so if their mom says, oh my gosh, that's just what I needed, this makes my day, they think mom's having a good day because she just got what she needed, right? They don't get that that's not really what she's saying. They misunderstand humor and sarcasm, so it can affect their social relationships. They can be very literal about things, so you always want to make sure you're saying what you mean. They can have difficulty following directions, again, because they don't understand the intent behind what you're asking sometimes. This can affect their friendships. It can affect friendships and relationships in the home. And you can even sometimes hear it in their own voice. You'll hear that their own voice is monotone. Yes?
The early part of this sounds a lot of like what you see in kids on the spectrum too. So is that just a coincidence?
Yeah. So her question was, the early part of this sounds like kids who might be on the autism spectrum, and wondered if that has something to do with it. So the definition of auditory processing disorder says that it's the auditory piece of it alone and that other things are not feeding into it. I firmly believe that auditory processing happens in all kinds of people, and you can make it better in all kinds of people regardless of what their label is, if you will. And so if we find that this is an issue for somebody, again, it's a skill that if we can define it, if we can point it out and put our finger on it, then we know what to do to improve it regardless of what their label is. Does that make sense? Okay. And last, they sometimes will seem very insensitive or awkward because, again, they don't get the social cues or the prosodic cues that they're hearing. So what do we do for a student who has a prosodic deficit? Well, environmental modifications, now we don't necessarily need to make things quieter for them. Environmental modifications in this case should focus on the intent or clarifying the intent behind what you're saying. So sometimes you've got to be very, very specific about what you're saying, why you're saying it, Or if, say, you're in a classroom or in a family situation and somebody says something that they misunderstand, pointing those things out to them. Compensatory strategies should focus on helping them to understand and recognize facial expressions and figurative language. I had a student I worked with, and he kept a diary of all the weird things that people say, like it's raining cats and dogs. And at the end of the day, he would go through and we'd talk about, what does that mean? Where did that come from? And how do you interpret how do you interpret that when someone says it? It's shocking how many of those things we say in a day, because his journal was awfully full of things. Remediation activities should focus on recognizing and interpreting tone of voice cues, pitch, timing, stress. And the most likely professional to work with this group of kids would be a speech and language pathologist. An integration deficit, so actually decoding happens on one side of your brain, prosody happens on the other side of your brain, and an integration deficit is those two sides putting it all together and communicating with each other. So kids with an integration deficit, and sometimes you'll hear this called an auditory integration disorder, this reflects a difficulty of that communication between the two sides, and that's mediated by the corpus callosum. And so kids who struggle with this will have difficulty following multimodal directions, meaning directions that are happening in two ways. So we've all been in classrooms where the teacher has an assignment on the board and she's talking about it, but what she's saying doesn't match what's on the board. For instance, this is what I want you to do. And she's saying, get out your notebooks, turn to page 55, and you're gonna find something that's, the directions don't match what she's saying. That's something that's really hard for kids with an auditory integration deficit. So they need to look and then listen, or listen and then look, but they're gonna have difficulty doing those two things at the same time. They may shut down in noisy situations because it's just too much. It's not that they can't hear it in a noisy situation, it's just overwhelming for them. They're gonna have trouble with note-taking because if they can't look and listen, note-taking is adding 4 or 5 more steps to that process. And it's gonna be difficult for them just to do all of those things or process all of that information at the same time. They often have poor reading comprehension. They may find that following directions are easier if you give them one at a time and then wait for them to complete that direction before giving them the next one. And they can often be slow to respond even if they know the right answer. So it takes them a minute or two to put it all together. A beat or two, maybe not a minute or two. One of my favorite examples of working with a child with an auditory integration disorder is I had a little boy who asked me a question, and then as I was explaining my answer, he was looking at my forehead. And his mom looked at him and she said, look her in the eye when she's talking to you. I always tell him to look people in the eye when they're talking. And he looked at his mom and he said, but I can't hear her when I look at her. And so he couldn't put that all together. So what are some things we can do to help kids with auditory integration deficit? Environmental modifications for this group should focus on just simplifying the environment. We don't want artwork on the walls. We don't want extra things happening in the classroom. We don't want centers because you know what? That's too much information and too much going on for them. Compensatory strategies should focus on matching directions with what's in front of them. And so listening and looking, or looking and listening, but teaching them and helping them understand that one thing at a time is all you need to take in. Remediation activities should focus on building interhemispheric communication. And I think this one is so much fun because you can strengthen your corpus callosum by doing a lot of different things that aren't even auditory in nature. And so these kids can benefit sometimes from piano lessons because I'm asking them to do something different with both hands with a piano lesson. They may have They may do karate, something like that might be helpful for them. Learning to ride a bike is probably going to be hard for them, but it might be helpful for them. So building their ability to use both sides of their body is often a really good way, and you will see that their auditory skills improve with their ability to use both sides of their body. The professionals that are most likely to work with this student would be a cognitive trainer, a speech and language pathologist, sometimes an audiologist, because we can do different things with the two ears at the same time. I can have different information coming in here than I have on this side. So sometimes an audiologist and sometimes an occupational therapist are good professionals to incorporate. So we've talked about the left side, we've talked about the right side, we've talked about the communication between those two sides. So those three first subtypes that I presented, those are all what we call primary subtypes. We can tell it's this side, or the middle. But we also have two what we call secondary subtypes of auditory processing disorder. And we call those secondary subtypes because they kind of cross the line between auditory processing and other challenges that kids have. But they do have very specific test result patterns that we can identify and very specific behaviors that go along with that. So an organization deficit is the first of those, and these kids do exactly what an organization deficit sounds like. They have difficulty keeping events, numbers, directions, things that are presented to them auditorily. They have trouble keeping those in order. So they may have funky word order when they talk to you, or they may get mixed up when they're telling you a story about their day. They may get mixed up in the order of events that they're talking about. They'll have inconsistent responses to familiar routines. So if you give them the same direction every day, go upstairs, brush your teeth, comb your hair, and come on down for breakfast, it's like starting over every day with what order that goes in. They'll have difficulty, or they'll reverse or mix up syllables and sounds in words. So tomorrow sounds like tomorrow. And so they'll say funny things like that. They may be very disorganized and scattered. They may have poor recall for lists and sequences. If you give them 3 sentences and ask them to put them in the most logical order, they're going to have difficulty doing something like that. And they'll have trouble retelling, like I said, stories and events from their day because it just sort of gets all jumbled up in there. I feel like it's like if you put a stack of papers on a desk and the wind comes through and blows them all over the place, they're putting them back together and it's all mixed up in there and they can't seem to retrieve it or pull it out in the right order. So what do we do for kids who struggle with this? So environmental modifications should focus on increasing the redundancy or the cues that are available to them in their environment. That might include things like visual calendars or visual schedules, or other visual aids or other things that just kind of keep them organized, whether that's internal, helping them internally organize themselves, or external, things that you're imposing upon them to help them keep track of things. Their compensatory strategies should be similar to that, helping them not only with providing tools like that for them, but teaching them how to use them. So you can provide them with a visual schedule, but they may not use it. You may have to still go through and be very explicit about how that should be used. Their remediation activities should focus on building organizational skills. And the most probable or most common professionals that might work with kids who have an organization deficit would be a cognitive trainer, a speech and language pathologist, an occupational therapist, or sometimes the special education teacher if they're in a regular classroom. And the last of our subtypes is an auditory association deficit. Auditory association deficit, you remember how I talked about these secondary subtypes kind of flowing back and forth, the line, blurring the line between this and other challenges. An auditory association deficit is very similar to a receptive language disorder. They have difficulty attaching the meaning of what they're attaching meaning to the sound that they're hearing. So these kids will have very poor auditory comprehension, not because they didn't hear it correctly, but because the way that they're understanding it is it's difficult for them to do that. If you ask a question in a funny way, like different than what you normally do, like if you say, on that table over there, bring me my cup, that's a totally different direction to them than bring me my cup off the table. So being really direct with them is super helpful. They'll have difficulty understanding figurative language or abstract language. These are kids who need that diary or that journal of different idioms or things that we say all the time, but that's not exactly what we mean. These are the kids who are actually going to the window to see the cats and dogs coming down from the sky. They may learn vocabulary better when they're reading it than when they hear it. And it'll take them longer to follow directions because they really just have to think about what the heck you just said. These kids will struggle more in language-rich subjects like English or history, or struggle with math word problems, even if they get how to do the problem. So what do we do for an auditory association deficit? Environmental modifications for them should focus on just being clear and concrete. We want the signals that they're hearing to match the message that we're trying to send to them. Compensatory strategies should focus on familiarity and clarity. So one of my very favorite things to do with these kids is to, if a new topic is going to be presented at school, to go over the vocabulary with them beforehand, to go over the concept with them beforehand, so that when they hear it in the classroom and people are asking questions, they're already familiar with the topic. They're familiar, they've heard the vocabulary before. And remediation activities should focus on comprehension of language and auditory memory. So of course, the professionals who probably are most qualified to work with this student would be a speech and language pathologist or a cognitive trainer. So things that remediation is good, but things to really keep in mind when you're talking about remediation strategies is the strategy that you're using with them needs to be targeted. You need to be working on the weakness that that student has, and you don't ever want to be working on something that's easy for them. So always be looking for where their challenge is and target that challenge directly. Remediation and brain plasticity requires that you practice those things. And so once you can figure out where they need the practice, then you want to practice it over and over again. You want to work on things that are challenging for them. Once they practice it and get good at it, you want to challenge them again. Once they practice that and get good at it, you want to challenge them again. So always kind of pushing the envelope of what's easy and difficult for them. Your remediation works best one-on-one. This is not something that you can often do in a group. It's one-on-one with these kids. And there are some auditory training programs, like digital auditory training programs that are out there. One-on-one with a person always seems to work better because it's just more motivating and interesting and exciting to work with a person. And so my preference is one-on-one training over one of those digital programs. Intensity matters. You want to be working hard during your sessions. You want to be able to give them lots of opportunities for practice. We talked about it being sequenced, so you're always making things just a little bit harder, just pushing that envelope a little bit. And immediate, accurate feedback is so helpful. You don't want to be saying to a student, oh, stop and think about that one more time. If they could have done it right the first time, they would have done it right the first time. So tell them the right answer, give them another opportunity to do it correctly, and then give them more opportunities to practice that. Finding a qualified audiologist to do testing like this can often be difficult for parents too. So the American Speech and Language and Hearing Association is our national accrediting body, and ASHA on their website has a page called ProFind, where you can search for audiologists in your area who might do that type of testing. So that's a really good place to start. I would say that in any given state, there probably isn't an audiologist who does this type of testing in every city. And so search your state, don't just search for your city or your zip code. Look a little further than that. You can also ask a local audiologist, because not everyone does this type of testing, and they're always having to refer to have this testing done. They're gonna know who is within driving distance or traveling distance for you to go to. So even though they might not do the testing themselves, they'll be in touch with or know of somebody in your area who can do that for you. And similar to that, local medical professionals who work with these kids or are involved with these kids will often know those audiologists as well, because for the same reason, they're having to refer out to that. And they just need to know who those people are. So some key takeaways that I want you to leave here with are that auditory processing disorders are identifiable. We can be really specific about where we think the issue is for a child, and making the right identification is important because that dictates how we treat that challenge. So auditory processing can affect academics, it affects reading, writing, understanding, it affects relationships, it affects friendships, it affects future choices. So addressing these challenges really beneficial, really important. The wrong diagnosis and the wrong treatment, or the wrong diagnosis can lead to the wrong treatment. So you don't want to be treating somebody with an attention or for an attention disorder if really it's auditory processing. And one good way to figure that out also is if you are treating them for attention deficit disorder and nothing changes, well then let's dig deeper, let's look farther. Again, accurate identification leads to better outcomes. It's important to treat what needs to be treated. And because it impacts social interaction, it also will often create frustration and confidence challenges for kids. And treating the right issue improves those things for children. And my favorite reason to diagnose and treat is because it is treatable. It does get better if you focus on the challenge. It always can get better than what it is. It can't always go away, but giving kids every opportunity to have every tool that they need in their toolbox is just really important. So if anyone has questions, feel free to reach out to me. I'm happy to take your questions. I'm happy to help you with resources, and this is how you can reach me.